The spread of the coronavirus. The World Health Organization says the risk of the virus expanding worldwide is now classified as very high. And there are new cases of the disease here in the United States. 16 cases so far have been detected and confirmed in the U.S. Another 47 people were evacuated from the Diamond Princess cruise ship and from the region in China where the coronavirus originated, for a total of 63 patients. They are being treated in 8 different states. But overnight, more suspected cases are popping up, some of them leaving doctors with more questions. Michael George is here with the latest. Michael, good morning.
Good morning. There are new suspected cases in California, Oregon, and Washington. Doctors treating the 2 patients in California and Oregon don't know how either of them may have contracted the disease. None of the patients had traveled to an area where coronavirus has circulated, nor have they come into close contact with a confirmed case. As health officials try to contain the virus, it continues to put millions of people in this country on edge and rattle the markets.
I understand that this news is concerning. However, I want to reassure you that our state and local authorities are responding quickly to the case.
Oregon Governor Kate Brown announced Friday someone in her state tested positive for coronavirus. While the Centers for Disease Control haven't confirmed the diagnosis, the patient is in isolation at a hospital.
This is a case of community spread of the disease, much like the case from California earlier this week.
The CDC says it's aware of another suspected case of community spread in Santa Clara County, California. Health officials say the patient is an older woman with no known contact with the disease.
What we know now is that the virus is here, present at some level, but we still don't know to what degree.
While the CDC is trying to track down anyone who's come into contact with these patients, the government health agency admitted Friday there's a shortage of test kits. So far, fewer than 500 people in the U.S. have been tested. Meanwhile, stores have been selling out of face masks, and the FDA warned there could be potential disruptions to supply or shortages of critical medical products, with as many as 20 medications with ingredients from China already at risk. The coronavirus sent another shiver down the spines of investors Friday. The Dow Jones Industrial Average was clobbered for a 7th straight day. The key stock index lost 3,500 points this week, wiping out more than $3 trillion worth of value.
This has happened fast and furious, and there's way more unknowns than there are known.
The travel industry could suffer as well, losing potentially more than $46 billion a month, as United Airlines announced it's suspending service to major hubs in Asia. Americans are canceling more trips, while travel insurance demand jumped 60%.
We're telling people that they should make sure their health insurance is in place before they go, that they should see their health provider before they travel, and certainly have all their health insurance documents with them when they're traveling.
And a number of colleges and universities are suspending their study abroad programs and recalling students to the U.S. And Amazon has told its 800,000 employees to postpone any non-essential travel, both internationally and within the U.S. Jeff?
Well, all right, Michael, thank you very much. While U.S. health officials work to contain the spread of the virus here, 8 more countries announced their first cases on Friday. To date, more than 83,000 cases have been reported worldwide, the vast majority in China. Cases have been confirmed in 53 nations. The virus is blamed for more than 2,800 deaths so far since it was first reported late last year. This morning, the State Department is urging Americans to reconsider travel to Italy, where there are more cases than anywhere outside Asia. Charlie D'Agata is in Rome. Charlie, good morning.
Good morning, Jeff. Nowhere in Europe has been hit as hard as Italy. Another 200 or so cases have been announced, and now there are new fears that this virus may have been around for weeks before it was picked up. There is growing evidence that Italy has not only been one of the epicenters of the global outbreak, it helped export its spread around the world.
We don't know when the virus has arrived. Maybe that arrived earlier than we detected.
He said the virus went viral, with carriers traveling from here undetected too. Originating from China, the virus has now spread to more than 60 countries and counting. New Zealand, Nigeria, Lithuania, Belarus, Azerbaijan are the latest countries to report new cases. But South Korea has seen the largest surge. More than 800 new cases in a single day have swollen figures to more than 3,100, the largest outbreak outside of China. Health ministers are urging residents to stay indoors and by all means avoid all public events, including church gatherings. Japan has taken even more draconian measures, canceling classes for more than 12 million students, shutting down schools for a month in order to stem the spread of the virus. Iran, another country that has given rise to a cluster of infections, took the extraordinary step of canceling Friday prayers for the first time since the revolution in 1979. Now, the tourism industry here in Italy had already taken a huge hit before that State Department advisory. The foreign minister here is urging all visitors not to cancel their plans. Michelle?
All right, Charlie, thank you.
So we're going to start with our continuing coverage of the coronavirus outbreak. The death toll and the number of confirmed cases in China continues to rise. For the latest, we are going to connect straight away to our Che Jong-yoon, who's on the line for us. Jong-yoon, these numbers just keep on ticking up in China.
Well, Mark, as of this morning, the death toll in China is over 900, with 97 deaths recorded in the past 24 hours. This is the first time there have been more than 90 recorded deaths in a single day. 91 out of the 97 deaths come from the Hubei province, the epicenter of the outbreak. There were also some 3,000 more confirmed cases, bringing the number of confirmed infections to more than 40,000. On a brighter note, the number of new cases has stabilized in recent days. Other areas of China, except for the Hubei province, have seen a downturn in the number of newly confirmed cases for the past 5 days in a row. New cases across the rest of China were reportedly staying at some 500 a day as of Friday. The most recent data from China's National Health Commission also shows new cases as of Sunday stand at some 300. Meanwhile, anxiety rises as millions of Chinese are set to return home following the end of the Lunar New Year holiday, which was extended to February 9th.
Well, let's hope we can trust those numbers coming out of the Chinese government. There has been some controversy as to whether they are telling us the real scale of the crisis there. But let's move on to the situation in Japan. It also has a problem of its own, namely this cruise ship, the Diamond Princess, docked at the port of Yokohama.
Yes, 6 more people on the cruise ship that has been quarantined for nearly a week have tested positive for the novel coronavirus. According to Kyodo News, 6 people were added to the confirmed cases of the Diamond Princess, 5 of which are crew members. This brings the total number of confirmed cases on the vessel to 70. About 3,700 people have been quarantined since last Monday after it was learned that a passenger who disembarked in Hong Kong on January 25th has been infected. The Japanese government announced on Sunday it would test all passengers and crew members on the ship. Previously, it had planned to test only those necessary. Japan vowed full support to aid those quarantined who are reportedly suffering a shortage in food and medical supplies. Meanwhile, confirmed cases outside of the vessel stand at 26 in Japan. Tokyo doesn't want to include the number of confirmed cases on the ship to the total cases in Japan. That's all I have for this hour, but I'll be back with more updates in our later newscast. Back to you, Mark.
While the number of people infected by coronavirus in this country remains relatively small, the impact on all of us grows almost daily. And so does a gnawing uncertainty over where all this is going. Today, as the national death toll climbed off the coast of California, we learned that at least 21 people on board a cruise ship are infected. And near the American epicenter of the virus in Seattle, a major university closing its classrooms. While in Texas, Austin's famous South by Southwest festival canceled as a precaution. Tonight, we're going to focus on the facts surrounding the disease, about how we can protect ourselves and each other. Our team is in place, and we start with the latest now from NBC's Joe Fryer.
Tonight, officials say 21 people aboard the Grand Princess cruise ship have tested positive for coronavirus, including 19 crew members. Thousands of passengers are quarantined on board off the coast of San Francisco, waiting for answers out at sea. At least 10 passengers who were on a previous trip on that same ship have also tested positive for coronavirus. One of them died. Meanwhile, at the nursing home at the center of Washington State's coronavirus outbreak, officials say 15 residents were rushed to the hospital in a 24-hour period. One resident, 89-year-old Elaine Herrick, died yesterday.
As far as we knew, she wasn't sick. So I was surprised.
The official death toll in Washington is 11.
We must prepare this region for the inevitable continued spread of this virus, at least in the short run. But we will do everything we can to slow its spread.
The outbreak is now prompting a major change at the University of Washington, which has 50,000 students. NBC's Steve Patterson is there.
Starting Monday, this campus will be empty. Students are going to stop meeting here for classes, all classes, even exams will happen online after a staff member tested positive for coronavirus.
Nationwide, 5 new states, Indiana, Pennsylvania, Minnesota, Kentucky, and Oklahoma, reported their first cases today. Los Angeles, a second medical screener at LAX, is now tested positive, while in Chicago, a 21-year-old college student has the virus after visiting Italy.
Just very mild symptoms like runny nose, headache, cough, difficulty breathing, but no high fever.
In New York State, 22 new cases today and 4,000 protectively quarantined, with New York City officials now pleading for more test kits, telling the federal government limited capacity has impeded our ability to beat back this epidemic. There's also growing worry among healthcare workers. A California nurse released a statement saying, "I am currently sick and in quarantine after caring for a patient who tested positive, but she's struggling to get tested." Other nurses worry their hospitals are not prepared.
Their employers don't have the basic and necessary measures in place to protect nurses and other healthcare workers.
Back at the nursing home in Washington, the quarantine is keeping couples like the Campbells apart. Married more than 60 years, now separated by glass, unable to touch. As for the cruise ship, officials have developed a plan that'll start this weekend. The ship will go to a non-commercial port. All passengers and crew will be tested. Those who need to be quarantined will be quarantined. Those who need medical attention will get it. Lester.
All right, Joe Fryer starting us off. Thank you. In Texas, a major headline tonight, the cancellation of the world-famous South by Southwest Festival. Just the latest big event to be put off as cities face the difficult choice over what to do about large gatherings of people. We get more from NBC's Tom Costello.
Tonight, a devastating blow to Austin's economy as the city declares a disaster and cancels this year's South by Southwest Festival that would have brought 500,000 attendees and hundreds of millions of dollars.
The COVID-19 threat is growing across the United States, and that threat is growing locally.
The move came after dozens of big-name sponsors pulled out. Meanwhile, Miami today also announced it's canceling the Ultra Music and the Calle Ocho festivals with 1 million visitors.
This decision is not a cause for alarm or panic.
The CDC says organizers may need to modify, postpone, or cancel large events. Already, European soccer games are being played without fans. College basketball games canceled. Northwestern University has canceled its annual dance marathon that raises money for charity.
Not seeing that come to fruition is, it really breaks my heart.
Health leaders say it's a tough call.
This is a virus, Tom, that can spread widely in the population. And if it does that, it will cause an awful lot of serious illness.
The Indian Wells Tennis Tournament, the LA Marathon, and March Madness, however, are all still on. But the New York Times reports on early conversations involving sports federations and the WHO about whether the Summer Olympics might need to be held without spectators. The IOC said today preparations for the Olympic Games Tokyo 2020 continue as planned. While younger people don't seem to be at as much risk, they could pass the virus on to somebody who is vulnerable, making every large gathering a potential concern. Lester?
Everyone's struggling to find the right balance. All right, Tom, thank you. And as we've seen all week, American business is taking a big hit from the coronavirus. Stocks tumbling yet again today, with the Dow losing another 256 points. Many stores reeling as well, and we get the latest on all that from NBC's Jolene Kent.
From Wall Street to Main Street, the coronavirus is slamming the economy. Small businesses like Rachel's Ginger Beer are in crisis mode.
This is just potentially absolutely devastating.
Located in the shadow of Amazon headquarters in Seattle, owner Rachel Marshall says her store has lost thousands of customers overnight because Amazon and other big tech companies have asked their employees to work from home.
Our employees are our #1 priority, and if they can't work, they can't make money. So am I dipping into my family's savings account to pay our employees?
At Kip's Toyland, the oldest toy store in Los Angeles, their inventory is dwindling as cargo ships from China aren't setting out to sea.
What's the impact on the toys that you're trying to sell here?
Good question. Things are beginning to slow down. Hopefully we'll be able to sustain ourselves until the supply chain gets filled again.
As unease grows about job security, many workers are wondering if they get paid if they're forced to stay home because of coronavirus. U.S. federal law currently does not guarantee sick leave.
Less than 60% of blue-collar workers get paid time off. We're talking about rideshare drivers, cashiers, and servers. Some say they're scared of catching the virus because they work face-to-face with customers and they don't have the option of working from home. Lester?
All right, Joe, Lynn, Kent, thank you. With anxiety growing across the country, President Trump visited the CDC late today, while his administration's response is coming under scrutiny over a lack of testing kits across the country. We get more now from Hallie Jackson.
President Trump at the center of the coronavirus response today, visiting the CDC. The off-again, on-again trip happening only after a CDC staffer suspected of having coronavirus tested negative, according to the president. The White House at first said President Trump did not want to interfere with the CDC's mission.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. And the tests are all perfect. Like the letter was perfect. The transcription was perfect.
That, apparently an incongruous reference to the Ukraine call at the center of his impeachment, coming even as state and local officials have criticized the administration for a sluggish ramp-up to get coronavirus tests to those who need them. That's after initial problems with some of the tests. The vice president, late tonight, announcing the U.S. has sent out 900,000 tests this week, with 200,000 more set to be shipped tomorrow, short of the 1.5 million he initially projected.
Next week, we'll keep ramping up production, so as many as 4 million tests next week are going to be driving forward.
An investigation by The Atlantic found only about 1,900 people have been tested for the virus in the U.S. Even the government's own top doctors critical.
I'm not happy about the lack of the appropriate number of test kits, that's for sure. But other areas of the response, I think, are going well.
As for those cruise ship passengers, President Trump says today he'd rather they stay on board the ship, but says he gave his team the authority to make that ultimate decision. Lester?
All right, Hallie Jackson at the White House, thank you. Now, beyond this country, efforts to contain the outbreak are greatly expanding as well, with more than 100,000 cases now reported worldwide. Our Richard Engel reports.
Global containment has begun to slow the spread of the new coronavirus by limiting human contact. Religious sites are a major focus. Bethlehem's Church of the Nativity, where Christian faithful believe Christ was born, is closed. Members of a church group from Alabama quarantined at a nearby hotel.
If we walk outside of our room we have to have a mask on and gloves on and all that good stuff. So no, there's very little leaving the room.
With the first case detected at the Vatican today, questions now if Easter Mass will go ahead in St. Peter's Square. In Mecca, Muslim pilgrimages have stopped. The Grand Mosque disinfected. In Iran, all Friday prayers were canceled. The Islamic Republic is threatening to use force against those who violate travel restrictions. As airports around the globe emptied out and get scrubbed down, Lufthansa, Germany's flagship carrier, announced today it's cutting capacity up to 50%. At the World Health Organization in Geneva, a reality check. Will coronavirus disappear in the warm summer months?
It's a false hope to say, yes, it will just disappear in the summertime like influenza virus.
In Singapore, where researchers are highly confident they've traced the origin of the virus to bats, doctors say they're working to defeat it.
Are we going to have to start quarantining people around the world and telling people to stay in your homes?
I think in the initial phase is yes. For this kind of problem, the world's got to work together or otherwise we're toast.
Richard Engel, NBC News.
And there's much more from Richard in his special report On Assignment Sunday night at 10 Eastern on MSNBC. The numbers of people who have been infected by coronavirus can sound alarming, but there are things we can all be doing right now to protect ourselves, as I learned during an afternoon with a leading figure in the fight against emerging diseases. Joseph Fair, a virologist and epidemiologist who's worked on the front lines of the Ebola outbreak in Africa, believes facts may be our best defense against the coronavirus. Let me ask you this. Is COVID-19, as you call it, is it in the air? If I take a deep breath, did I potentially take a deep breath of the virus?
Especially not outside. You know, we're sitting in front of nature's greatest disinfectant, which is sunlight. The UV light inactivates the virus.
So around all these people, I'm relatively safe?
Absolutely. You need to come into direct contact with it, either by someone coughing or sneezing and those droplets landing on your face, your eyes, nose, or mouth, or you've touched a surface and then you yourself touch your face, nose, eyes, or mouth.
And with that in mind, we set out to explore how to best protect ourselves from the virus. So public transit makes a lot of people nervous. I mean, this car is going to move. Usually there's not a seat.
Usually in close proximity.
And you're going to hold
Again, I'll hold it with a tissue. If I don't have a tissue with me, I'll usually do an arm hold like this. Just to keep my skin from contacting it.
But, you know, this idea of being 6 feet away from people, that's not going to happen on a
Not going to happen in
bus
here.
or train.
Right. And that's why it's up to the individual. You know, you've got to cover your mouth when you cough or sneeze with your sleeve, ideally. We know just from studies from San Francisco's metro that a lot of antibacterial resistant pathogens, et cetera, last on these surfaces for a very long time.
Next, we headed to the office. I think it's probably fair to say millions of Americans work in environments not unlike this, sitting, 6, 7 feet apart. What should we be conscious of and aware at this time?
We know just from slow motion video of coughing or sneezing that your average sneeze or cough can expel droplets that will travel anywhere from 3 to 6 feet, which is your average office space distance from your other employees. Ideally, you'll have tissue or some hand sanitizer next to you. You'll be able to reach quickly, grab a tissue, use it to cover your mouth when you cough or sneeze, immediately dispose of that tissue.
Don't put it on the desk.
Don't put it on the desk. Wiping the keys down.
And routinely disinfect your personal workspace, he says.
Everything here would be what we call a fomite, or a surface that can carry an infectious virus for up to 9 days in the case of coronaviruses.
So I sneeze, I wipe my nose, I pick up the phone, it's there.
Yes, absolutely, because this is really one of the filthiest areas, and including that cell phone in that. That's really one of your dirtiest areas. So I wipe down everything, all the keys, etc. I'll take my phone, wipe it down.
Another helpful tip, create a barrier between yourself and surfaces we commonly touch, like elevator buttons.
Tissues are not always going to be with you or practical, so sometimes I always carry a pen myself.
Pen.
Touch it with the pen.
And the most powerful tool to fight coronavirus is soap. Lastly, no more handshakes. We'll leave it with an elbow bump.
Sounds good.
Joseph Fair, who we're pleased to have as our new science contributor, he reminds us we're only as strong as our weakest link, meaning we all need to adopt these sort of measures. Now, let's be honest, despite the repeated advice we've been hearing to keep your hands away from your face, it's much, much easier said than done. Stephanie Goss tonight on how to break that habit.
The award for Do As I Say, Not As I Do goes to...
Start working on not touching your face.
All those officials telling us not to touch our faces.
Working hard not to touch your face.
While touching theirs. The president even joining in with a joke.
I haven't touched my face in weeks. In weeks.
Mr. President.
I miss it.
This photo taken 2 days before. But to be fair, everyone touches their face, nearly 24 times an hour by one estimate. A habit not easily broken.
Every time we touch our face, there's a risk of whatever's on our hands can get into our nose, our mouth, or our eyes.
What's called the T-zone. To see how difficult this is, I'm going to try just for an hour not to touch my face. 13 times, less than average, but I was actually trying. How do you break a habit that you're not even aware of?
It's a really hard thing to do, and the first step is try to be aware of it. Are we having allergies and we're rubbing our noses all the time? Are we having dry eyes and we're rubbing our eyes all the time?
Some basic tips. A box of tissues. Use one if you have an itch. Try to occupy your hands. A clean stress ball could work. Use a hands-free cell phone. And the best strategy? Clean hands. Just keep washing them. Stephanie Gosk, NBC News, New York.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.
At the University of Nebraska Medical Center, the first human trial for a coronavirus treatment is underway. The first patient, one of 14 cruise ship passengers from Japan, now undergoing treatment in Omaha. Eventually, 400 patients will be in the trial worldwide.
These are the people that will potentially have a more severe disease, more sequelae, and potentially even be a life-threatening situation.
Though the nation's health experts caution a vaccine may not be widely available for 12 to 18 months.
If this cycles and comes back next year, then having a vaccine a year and a half from now will be very applicable.
The latest numbers from the CDC, 60 known coronavirus cases in the U.S., though that number is expected to grow. The HHS secretary on Capitol Hill.
The risk right now is very low to Americans. From a public health perspective, we technically are in a state of containment in the United States.
At Holy Name Medical Center in Teaneck, New Jersey, the medical staff is already preparing.
Want to make sure you're pulling the cuff of the glove up over the entire sleeve.
Reviewing protocols for keeping a contagious virus from spreading.
This is called negative pressure room.
Including air-sealed treatment rooms.
And any staff that went into that room would wear appropriate gloves, goggles, masks, and gowns, with appropriate hand washing.
While San Francisco has no reports of coronavirus yet, the mayor has declared a state of emergency to free up resources. Other big city mayors trying to reassure the public.
Right now, we have 1,200 hospital beds that we can make available immediately for any individual who is in the testing process or who tests positive or needs isolation in a hospital setting.
In the event that we need to ramp up quarantining, we are absolutely prepared to do that.
Universities across the country are suspending their study abroad programs in hard-hit Italy and Asia. University of Illinois students Carly Peldiak and Grace Clavorn have left Italy and are now in Vienna, not sure where they're going next.
So I'm actually really freaked out. The first time in my life I felt like I don't know where I'm going to be next week.
The coronavirus threat still looming large.
Tom, there's been some confusion over whether there are enough protective masks and gowns in the event of an outbreak. What's the reality check on that?
So New York City today said it is asking the federal government to help get more protective equipment so that it's prepared. The FDA says there is no shortage of masks, of gowns, of gloves right now. It has 30 million stockpiled, but if there were a true pandemic, it might need 10 times that many. Right now, though, it is not sounding the alarm bell on that.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.
Across the country, sporadic reports tonight of store shelves emptied out as Americans stock up to hunker down. From bottled water to toilet paper to disinfecting wipes.
This kind of things which will help you sanitize, they're flying off the shelf.
Should the coronavirus grow into a pandemic, Homeland Security recommends having a 2-week supply of food on hand.
The items that are likely to disappear from the shelves, number one is going to be bottled water, canned foods of all kinds, frozen foods that have a short list of ingredients.
The virus's spread has forced the cancellation of trade shows and meetings, a global energy conference in Houston, a major science gathering in Denver. The Miami School District is now preparing 250,000 laptops and tablets for students to work from home in case the virus forces some schools to close.
We know it's not ideal, but it would provide a continuity of the educational process to kids who may have to be kept home and not at school.
Tonight, more universities are suspending study abroad programs in Asia and Italy. Airlines now canceling flights into Italy as American joins JetBlue and Alaska Airlines in waiving ticket change fees over coronavirus fears. A major travel insurance provider says business is up 150%, with travelers anxious to protect their trips from the virus, especially overseas.
You will get between 50 and 75% of your trip costs back. It's not 100%, but it's a great option if you're traveling and concerned at all.
Also tonight, Amazon says it's pulled 1 million products off the shelf for price gouging or false advertising related to the coronavirus, including those protective face masks.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.
As fears surrounding coronavirus spread around the world, here at home, many are starting to worry basic necessities will sell out in the event of an epidemic.
CBS 2's Kieran Dillon reports some people are stockpiling.
At this Costco in Teterboro, New Jersey, Pam Bruno is stocking up 10 cases of water and...
I bought the paper towels just in case. Those always at my house run fast. And toilet paper.
Her daughter is pregnant, so she's stockpiling in case the coronavirus continues to spread in the United States.
What was the catalyst that made you decide today I'm coming and I'm going to do it?
New York City. New York City got hit.
And she's not the only one. Inside Costco, lines of shoppers are loading up with essentials. Next door at Walmart, shelves usually full with bottled water and hand wipes sit bare. And in Manhattan at Morton Williams, shoppers are on high alert.
And we may have to be staying at home, so we may not be able to shop.
As you can see, everything is empty.
Store supervisor Orlando Olave says business was up 10% this weekend as a result of coronavirus fears.
What's going the most is water, canned soups, canned goods, fruits. That's also going.
Morton Williams says after running out of hand sanitizers last week, it restocked all of its 16 locations with a total of 700 new cases. By the end of the weekend, those two were gone. Still, many shoppers say they're just not worried.
Because there haven't been that many cases in New York, and I think everybody's panicking.
The best thing that people can do is just be reasonable and take precautions that you would do in everyday life. Wash your hands.
But Pam Peters disagrees.
You prepare, you get ready, you buy the items you need to. If it comes, it comes. If it doesn't, you still have a lot of water.
She says it's better to be safe than sorry. Kieran Dillon, CBS 2 News.
And CBS 2 reached out to various retailers. Walmart said it's working with suppliers to solve any supply chain disruptions.